Yeah, it's our next video of the week. Thank you so much for being patient, and thank you so much guys for the support. Since we have already given you a lot of introduction about myself, now we know each other. I'm sure you know me, I know some of you, because some of you have reached me via my inbox. It is a thank you so much. Judith Nalukwaga, as usual. I'm here as your dentist. One, I would love to recap the things I mentioned about last video. Very many people came to my inbox asking me so many questions, and I was able to answer some, but I'm sure even some of you didn't come to ask me. You still have the same questions. So I wanted to make a general recap so that you guys can understand. Many of you are asking me questions about a toothbrush. Many of you are saying, but Judith, those soft bristle toothbrushes cannot brush our teeth. First, we want these hard ones where you scrub and you feel like your tooth, oh my God, it's shining. Now, let me tell you one thing is, when you eat food, remember you brushed in the morning. Now, when you eat food at lunchtime or in the evening as you're going to sleep, when you're going to brush your teeth. So, do you think the food you ate during that day has been able to solidify that much to be able to go onto your tooth, and when you use a soft bristle toothbrush that it won't go away, that it is that hard, that it has become hard in just a few hours? No, that food is there, but it doesn't become as hard as you think in a few hours. So even when you use a soft bristle toothbrush, which we said it's our ideal, firm but soft, it will be able to remove those food particles that you've eaten that day. Now, where the problem comes, if you've not been brushing well for a long time and you're seeing hard food particles that have been on your teeth maybe for over 6 months, and you think even a hard bristle toothbrush will remove them, no. That is where now I call upon you to go to a dentist so that they can use those machines we use, the specific equipment we use to remove those food particles that have stayed over time and they cannot be removed by a toothbrush. So you go to your dentist and they do a mouth clean. It's called mouth cleaning. They wash, they clean, they use that, it's called scaling. They use that equipment and they scale away those food particles that have been there over time. So don't waste your time on hard bristle toothbrush that it can remove those food particles. No, it cannot. It cannot. It will just spoil your gums and also spoil your teeth and lead to sensitivity. So please, every 6 months you have to visit a dentist for regular checkup, and also to make sure you clean your teeth after 6 months. So some of you may not have a good cleaning technique, that these food particles may stay on your teeth even on your brush, but they may stay on your teeth and they solidify. So it is better after 6 months to go to a dentist so that they can use those equipment and they clean away those food particles that have solidified. But then on a regular, we said we use soft bristle toothbrushes because they are firm enough to remove these food particles that we've eaten during the day, because they have not yet become hard for us not to be able to remove them. So today's topic, we said we are going to talk about mouth odor, bad smell from the mouth. What causes this bad smell? You know, you cannot remove this bad smell when you don't know the causes. So we have to be knowing the causes so that we can be aware of bad mouth odor. So when you go into the causes, so I'll be giving you the causes and I also give you a remedy. So one is salivary flow. You see, in our mouth we need good salivary flow. Some of you don't have good mouth salivary flow. So if you don't have good salivary flow, this saliva helps us to wash on our teeth. Now, whenever it washes on our teeth, it helps to remove some of those food particles. It washes on our tongue. But if you don't have good salivary flow, that means your mouth is a little dry, and that one enables bacteria to grow. Which bacteria is bad? We have bacteria in our mouth. We have candida in our you know what I'm talking about. As women, we have candida growth in our private parts. But when the good candida exceeds the bad candida, remember, they are always there, good and bad, they compete, but they are always in equal amounts. But when the bad exceeds the good, that's when they get sick. That is the same in the mouth. So when you have little salivary flow, that is when the bad bacteria grows. That is also the bad candida. So when it grows in our mouth, because of poor salivary flow, that's when we start having a bad smell. Remember, even in our private parts, when we have growth of candida, it doesn't smell nice. So happens in our mouth. Candida has very many kinds of candida. There is candida in our private parts, and there is also candida in our mouth. So if that candida is allowed to grow because of limited salivary flow, we are going to have a bad smell in our mouth. So check your salivary flow. If your salivary flow is little, some of the things we can do to increase our salivary flow. Remember, I told you in a video before you have to take enough water. It is very important. Remember, even the doctors tell us the importance of taking enough water for all our bodily things. Also in the mouth, we need enough water. So please take enough water so that your body can have enough fluids to secrete into saliva. So number one thing is check your water intake. Always take water. Then the number two thing is some people naturally just have little salivary flow, however much water they take. We can also use chewing gum. Chewing gum stimulates the salivary glands to produce saliva. You see, when you're about to eat, we usually see someone is salivating, because when the body senses, or when you smell food, the body naturally produces saliva. So it is the same as chewing gum. When you get chewing gum and put it in your mouth to chew, the body naturally produces saliva. So we encourage people who have a little salivary flow to start using chewing gum. But which chewing gum? Remember, we said sugars are not good for us. So we wouldn't want to use sugars. So there is chewing gum that has a compound called xylitol. Xylitol is a sugar, but that sugar is good. It's not bad sugar. So even if you take in a lot of xylitol, it is not bad that the bacteria will use it to grow. So we take either sugar-free chewing gum. There's chewing gum that doesn't have any sugar. These things of pique, no, don't take pique, because pique has sugar, which may not be the good sugar for our teeth. But then also there is chewing gum that has sugar, which is xylitol. So when you go to a pharmacy, you can ask for chewing gum that is sugar-free, that is good for salivary flow. Those guys know it, so they will give it to you. Or when you go to a dentist, the dentist themselves, they will give you a brand that has those sugar-free chewing gum. And next time when I come here, I will show you one of the brands that has a sugar-free or that has xylitol. I'll bring it for you so that you can see it. When you go to these pharmacies, you can be able to buy it. So that is the other thing of stimulating salivary flow. And also the other, number two, now salivary flow, number two is sugars. Sugars also contribute to growth of bacteria. Like, we've been mentioning this over and over. I think by now you guys should be knowing that sugars are not good for us. But I am not telling you to take out sugars completely. But you can take it through fruits, because fruits are very important in our diet. So sugars like the normal sugar we take in tea, the sugars you take in chewing gum, even food itself, carbohydrates like posho, everything that has grains, posho, millet flour, what, all those contain sugars. Now, if you take a lot of those and they stick into your mouth, even when you take this other sugar, when it sticks into your teeth, I told you, these bacteria get something to feed on and it enhances their growth. So these bacteria, if they grow, that means they're going to produce acids. These acids can create holes in your teeth, and they create teeth to decay. Remember, when the tooth is decaying, it can also produce a bad smell. So that smell might be coming from a decaying tooth. You one day, I told you guys use floss. One day get your floss and start flossing. Then you smell that floss and smell how what is coming from there. Just put it close to your nose. You will see. So you will smell that the smell is not that good. If it's not, the odor is not that good, the smell is not that good. And if it's not good, that means in between our teeth, a lot of bacteria hide from there. So if we don't floss there, that means we are giving them chance to grow and they cause that bad smell. Also in cavities, like those holes that the bacteria have formed, there is a lot of bacteria that is producing that bad smell. So that bad smell might be coming from in between your teeth because you don't floss them, or it may be coming from a decaying tooth. So you also have to check that. Go to a dentist so that they check, because some decaying teeth you may not be able to see them with your naked eyes because they're in between other teeth. So you have to go to a dentist and they use those special machines to check, and they see that there is a hole in between your teeth. That is when they will find out, is it the one causing your bad smell or something. So if it's the tooth, then either they work on it, or if it's too bad, they can remove it. That is another remedy. So those are two things so far we've talked about. The other thing is toothbrushing. People, we've talked about toothbrushing. I've showed you how we brush your teeth. I've showed you different toothbrushes. I've showed you the toothpaste. So if you don't brush your teeth well and regularly, it could be those food particles that are decaying in your mouth and also causing what? Bad mouth odor. For example, on our tongue. Do you know that on our tongue, our tongue is made of small, let me show you how it is. Let me draw for you. here on my small notebook, and I show you. So our tongue is made like this. These ones are called papillae. Our tongue is not flat as some of you might think. No, it is made of small ups and downs, which we call papillae. Actually, if you go into the mirror and scratch your tongue and get close, you will see these particles are there. They're small. It's in dentistry we call them papillae. Now imagine if you eat food and it goes in this depression. That means if you do not brush your tongue, the food particles are going to stay there, and when those food particles stay there, they can start rotting, they can start decaying, and the bad smell might be coming from actually your tongue when you don't know. So it is very important. That is why I was teaching you brushing techniques. Also, if the food stays between your teeth, it can also cause that bad smell. That is why I started with toothbrushing techniques, how we brush our teeth, so that when I reach here, we already know these reasons. So always brush your tongue to remove those food particles. Brush your teeth well. So some of that decayed food that has been there for years or for months can also cause that bad smell. That is calculus. That is why we need to go to a dentist every 6 months to examine whether we have that decayed teeth, and also do a mouthwash, as in to clean our teeth. They clean using those special equipment, they scale, they polish. So it is very important. Number 4, it's going to be food. You see that some foods we eat that give us temporary mouth odor, but these ones, as when the day goes by or when we brush our teeth, the mouth odor can go away. For example, onions and garlic or eggs. So our mouth, this bacteria in the mouth digest sulfur. These food compounds I've given you contain a lot of sulfur, and you know how sulfur smells. Some of you know sulfur dioxide, etc., and you know it's bad smell. You know it very well. So if you eat sulfur containing foods, for example eggs, you eat onions, you eat garlic, you will have that bad mouth odor. So what do? After eating them, you can brush your teeth, or after eating them, you can use peppermint. Some of you know peppermint, right? There is chewing gum that has mint in it. You can use mint, or you can chew a normal mint, the natural mint. Some of you know it. Or you can chew what is it called, parsley or mujaja. Let me say it in Uganda because it's easily. When I say parsley, some of you may not. I don't think it's called parsley. I've forgotten its real name. I'm not sure whether it's called parsley or it's called I'm not sure, but at least when I say omujaja, most of you know what it is. So omujaja is very good for you. After eating these foods, you can also chew on omujaja, and the smell will go away, definitely. So once you eat these foods, either brush your teeth or have mujaja and chew on it, or you can take it in tea as well, and the smell will go away. So that is the number 4 thing. Then number 5 is digestive diseases. In our digestive system, especially the stomach, can be bacteria can invade it. You see, our digestive system has bacteria. That bacteria is also good for digestion of our food. But when it becomes too much, it becomes bad. That is why I told you, our bodies naturally have bacteria. But it's a balance between the good and the bad. If they're in equal quantities, we're okay. But when the bad exceed the good, that is when we start getting problems. So in our digestive system, we have those bacteria. So when they grow, the bad ones grow too much, they begin releasing compounds, or they begin releasing gases. Now those gases are the ones that come back into our stomach. I think you've seen people belching. There are people who belch, like I think someone has ever told you people, for me, I belch. It like, not that I've eaten food, like every other time I'm always belching, and the belching is a bad smell. So most cases when someone belches, the smell is not good. So there are some people whom it has become a habit, like it has lived into them. It's because they have a lot of bacteria in their stomachs. So those bacteria produce a lot of gas. When they produce a lot of gas, they have to release the gas. And how do they release it? By belching. So some of them may not belch loud for you to hear. They may belch silently. But then when they open their mouth to speak, oh my God, you do not want to be close. So the way to remove that bad smell from the digestive system, and that could be the reason why most of us have a bad smell, and we don't know, but it is a problem in our stomach. How to remove that is, first of all, you have to first treat that stomach problem. If you don't treat the stomach problem, trust me, whatever you do, even if you take mint, even if you take chewing gum, I can assure you, there's nothing that is going to improve. You improve it for the first 2 hours when you take that, but then it will come back, it will keep coming back. So if you find yourself that you have that problem of belching, go to a doctor. That one is not treated by a dentist, it's treated by a normal doctor. Go to a normal doctor and explain to them the problem that you have, and then they treat it. Once the bacteria in the stomach is over, trust me, you will never have that bad smell again. So you have to go and you get treated. Then the other thing is these other diseases that may not be stomach diseases. For example, liver diseases. Liver diseases also cause a bad smell in the mouth. Diabetes. What is diabetes in Luganda? Diabetes, yes, sukari. You see, some of you have parents, you have friends who have baina sukari. Now with diabetes, you have mouth, it has mouth complications. So when it becomes hard for the patient to brush their teeth, you know, when you have wounds in the mouth that are caused by diabetes, it may not be easy to brush your teeth and cause good oral hygiene. That is what causes our mouth to smell, because you're not brushing your teeth well. But if you have a patient with diabetes, please try as much as possible. Encourage them. I know it's not easy, but encourage them to brush their teeth. Liver cirrhosis. Liver cirrhosis is like the problem comes from the liver and the stomach. So they come from down in the digestive system. Then you keep exhaling that bad air. So unless the liver disease is treated or the stomach disease is treated, there is no way that you can get rid of that bad smell. So some of those things, it needs the general doctor to first treat them, then the dentist will find a walkover. What I can assure you, someone who has a bad mouth odor, most cases they don't know. It is hard for them to know, I can assure you. So actually they might come to speak close to you like this. It's only you can know that this person has a bad mouth odor. But don't tell them, hey, go unya kamwa. No. It kills their self-confidence. You can take them aside, talk to them as a friend. Tell them, you know what is coming from your mouth is not good. But you can do this and this and this, and advise them. But as long as you just push them away and throw it to their faces, trust me, it kills their self-confidence and it's not good. So we have to talk to them in a friendly manner. What I can tell you is 90% of the people who have bad mouth odor, they don't know. It is our friends who tell us that, well, your mouth is not smelling well, or some of them are just discovered at the dentist place. So how do I check that I have a bad mouth odor? How do I check on myself? You see this part of the hand? In most cases, this part of the hand is always clean. So what you can do, you can just clean it with a cloth and normal water. Then you breathe, using your mouth, through it like that. Then after breathing like that, then you smell. There, if you find the smell pleasant, then you may not have a problem. Don't do it after brushing. Do it normally, like randomly during the day. If you don't find the smell pleasant, then that is where we have a problem. So that is when you start taking care of your mouth, or you go to a dentist to check out what could be the problem. If you've not understood anything, you can always come to my inbox and ask me, because bad mouth odor is a common thing. Very many people have asked me, please produce a video about it, please produce a video, and I have. So if you haven't understood anything, please ask me, either in my inbox or in the comment section. I'll be able to answer your questions. And please share this video with your friends, because most of our friends have bad mouth odor. And also, next, people are over asking me, Judy, if I have a painful tooth, how can I stop the pain before coming to a dentist? That is very important. My next video is going to be on pain relief. How do we naturally or at home, how do we relieve ourselves from this pain that is caused by toothache before you even come to a dentist? So that is what our next video is going to be about. Thank you so much for listening to me, and see you soon next week. Thank you so much. Bye-bye.